What are some great stretches for a sciatic pain? When patients complain of low back pain or pain on the leg, a very often diagnosis they receive is something called sciatica. And patients are very often looking for relief for the pain that they feel from something called sciatic pain. Well, first of all, to understand how to help sciatica or help look for some stretches that can help you with sciatica, we have to understand what sciatica is. Sciatica is actually referring to something called the sciatic nerve, which is the largest nerve in the body. It's a nerve it's a nerve that's comprised of 5 nerves that exit the lumbar spine, goes down the back of your leg, down back of your calf, and into your foot. This union of the 5 nerves is something that we call the lumbar plexus. And so therefore, any of these nerves that get affected from the spine can actually cause something we call sciatic pain. Sciatica is not actually a disease, it's just something that's affecting the sciatic nerve in particular. Sciatica is specifically defined as radicular pain or pain that's kind of radiating or traveling down the pathway of the sciatic nerve. And it can be felt anywhere, down into your glutes, into your hamstring, into the back of your legs, and into your feet. And the pain can be severe and stabbing pain. It can be radiating pain. It can be tingling. It can be numbness. It can also be weakness down those nerves. Can also lead to something called sciatica. But most commonly, it's felt on the left side of the body. It's where the most common the symptoms are found, and it's normally gets increased or feels worse as you experience compression to the body, meaning any kind of downward force, because the pain is normally a result of compression or impingement of the nerve roots that actually exit the lumbar spine. So even because you're feeling pain down the leg, you actually don't have a leg problem. Most likely it's coming from the lumbar spine. One of those 5 roots are being compressed, which actually compose the sciatic nerve. So some very common causes, obviously, is going to be anything wrong with the spine, meaning like any kind of intervertebral disc issue, like disc degeneration, any kind of disc bulging, any kind of disc herniations. These things occur because when the spine shifts out of alignment, it affects the disc. And when you affect the disc, it can affect the discs can start to affect the nerves that exit right next to the disc. But remember, the disc is only responding to whatever the spine is doing, so therefore it can start affecting the nerves that exit that area. Something called spinal stenosis. Spinal stenosis is when there's narrowing of the spinal cord. Now, this can happen one of 2 ways. It can happen most commonly as a result of spinal degeneration. Spinal degeneration means the bones of the spine are going through a degenerative phase. When they go through a degenerative phase, they develop bone spurs and bone degeneration, which can narrow the spinal canal where the spinal nerves and spinal cord go through. It can happen as a result of misalignment. When the bones miss out of line, there's holes that the discs and the nerves and the spinal cord is traveling through. Those holes become compromised when the spine shifts out of its normal alignment. Those are the most 2 common ways it can occur. But there also is congenital spinal stenosis, meaning that where the spine actually develops as during birth, that never fully matures into a full size, and there's something called congenital spinal stenosis. But the most common reason is because of spinal stenosis, because of disc degeneration and alignment. And unfortunately, the very last thing is something called scoliosis. Scoliosis can affect the nerves that exit the lumbar spine. The most common scoliosis is a left lumbar spine, and that's why most people tend to feel sciatica in the left leg, because that's the side that's being affected. Scoliosis is when the spine structurally develops an unnatural or abnormal sideways curvature of the spine, and this sideways curvature also has a twist or rotation associated with it. Again, the most common scoliosis is a left lumbar and a right thoracic, so that's why the left leg tends to be most commonly affected. The most common symptoms of sciatica is definitely pain in the area of compression, and that would typically be the lumbar spine, and normally it can be just generalized low back pain. It can be very specific pain in that area, like very pinpoint kind of stabbing like pain. It can be radicular pain that felt into the lower extremities. Typically, it affects one leg more than the other. Very rarely, it's bilateral pain, and it's normally down the back of the leg, down into the back of the calf, and it goes typically into your foot. You can have numbness in your toe, and it can be a result of sciatica, meaning the nerves that actually innervate the toe are being affected in the spine, and it can lead to that issue. You think you have a toe issue, but the truth, it could be sciatica from the spine. The pain can be very mild, it can be intermediate, it can be very chronic, it can be very acute. but unfortunately, it can get very debilitating. And when sciatica gets very debilitating, people are looking for anything that can help them. In fact, one of the most common reasons why patients get spinal surgeries is because of the result of sciatica, because the pain is so severe and so debilitating, they become unfunctional. So if you have any type of signs of this is occurring, normally it worsens over time. It doesn't get better, but it just worsens. Even if you do things that kind of to help improve what you're feeling, it still tends to worsen because it tends to be an underlying structural problem with the spine that if it's not corrected, it could progress. But what are some things you can do if you're feeling some sciatica to help get you through until you can go actually have your spine evaluated? There are some simple stretches. Scissors hamstring stretch is a very good stretch to help try to reduce sciatic nerve tension and pain. Now, sometimes this stretch, while you do it, may increase the sciatic pain because it's actually stretching the nerve a little bit more. And if it does, you have to make sure you do it to tolerance. You don't want to do it where you're massively increasing any type of pain or discomfort as a result of stretching. So you want to stay within tolerance. Sciatic nerve glide exercise is also a great exercise to perform, helps relax the sciatic nerve, and it's also less prone to irritation and inflammation as a result of this nerve glide exercise that you can perform. And back flexion stretch is a stretch that you can help increase spinal and muscle flexibility in the lower back to help your body deal with or help you deal with the pain that you're feeling as a result of sciatic pressure or sciatica. But the best way to treat sciatica is to actually address the cause. These stretches are just really dealing with what you're feeling. The way you address the cause is normally to find out where the underlying misalignment tends to be, and it is actually to address that misalignment. If there's as a result of scoliosis, you want to actually reduce the scoliosis. If it's a result of spinal misalignment or degeneration, you want to restore that spinal misalignment. And normally this is done in a very specific way using a combination of chiropractic care, physical therapy, specific scoliosis or specific degenerative exercises, and stretches. It's this combination that provides the best result. Doing one without the others normally don't provide the very best results. So I see a lot of patients, maybe they do some exercises, but they don't get chiropractic care or do any kind of therapy, or they do stretching, but they don't do specific exercises, or they get adjusted to do chiropractic care, but don't do the other things. So a combination of all these things coordinated properly to get the very best results. And most importantly, you want to see the spine change objectively. Not only do you want to see symptom improvement, but you want to say, okay, is my misalignment or whatever is causing the sciatica improving objectively? A lot of times this can be documented through x-rays or through range of motion exams or other objective exams. So you're seeing there's an objective improvement, not just a symptomatic improvement, because unfortunately symptoms can be hidden with treatments that don't actually correct the cause. And if you're not correcting the cause, you're truly not getting better. And more than likely, it's going to return, and normally it's going to return with a more severe and a more difficult way of trying to improve it. So exercises and stretches can definitely help keep the spine loose and muscles more flexible and more range of motion. But the number one way to deal with sciatica is to remove compression of the nerve impingement. And that's normally almost always as a result of spinal alignment issues or structural issues. At Scoliosis Reduction Center, we provide very proactive treatments to try to deal with the structural problem. And if you're feeling pain as a result of sciatica, we can actually help address that underlying cause and restore normal spinal position for you. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.